Hello, my name is Matt, and I am a Health Information Management student from George Brown College. And today, I will be presenting data about outbreaks that occurred in Toronto healthcare facilities. Before we proceed, I would like to clarify that I did not gather this data myself. The data I will present today was collected by Toronto Public Health. As indicated in the citation shown on the current slide, this citation is also present in the video description for your convenience. This video will focus on three key data questions that I found most significant to cover for the topic, of which I will address each one individually. The first question is about identifying the primary causative agent responsible for the highest number of healthcare outbreaks in Toronto in 2023. I find this to be an important starting point because understanding which agent caused the most outbreaks in Toronto is crucial before we delve into the other two questions, which we will cover later. Let's now discuss the data. As I present the data, please note that the term coronavirus in this data does not include COVID-19. Instead, it refers only to seasonal coronaviruses, as clarified by the Toronto Public Health in their data description. To address the first question, I find it most useful to present both the percentage breakdown, as represented in this graph, and the actual number of healthcare outbreaks on the left. This approach allows us to clearly differentiate the number of outbreaks caused by each agent. This reveals a significant disparity between the number of outbreaks caused by COVID-19, right here, which is our primary agent, and those caused by the rhinovirus, which ranks the second in the table. As we can see, COVID-19 has number of 700 healthcare outbreaks, while rhinovirus has only 77, which is clearly significant. We can also see here that in terms of percentage, COVID-19 has 65.67%, while rhinovirus only has 7.22%, which is a big difference in between the two. And this shows us the severity and morbidity of COVID-19 when it comes to healthcare institutions of Toronto in year 2023. Now that we covered the first question, let's move on to the second question, which examines the monthly breakdown of Toronto outbreaks by each causative agent. This question will help us visualize trends and patterns in the number of outbreaks, allowing us to identify which month experienced the highest peak of outbreaks for each agent. This is what our graph looks like for question number 2. And it lists down all the causative agents starting from January 2023 up to December 2023. Let's start with COVID-19. So COVID-19 at January has 78 cases, and drastically it has moved down to 37. But so it increased to 45 by April and went down slowly by 16 at July 2023. And then it went back up again to 93 until it reached 131 by December 2023. So what can we tell about this data? So first off, I want to point out that I added a trend line here. So the trend line shows the trend of the line graph. And we can see that the trend line has a positive slope, which shows positive correlation. It implies that there is a possibility or a probability that the measure values tend to increase as the month progresses. Now looking at this, the R squared is 0.32, which means that the trend line explains approximately 32% of the variability in the data, making the trend line moderately reliable while needing more evidence to improve. Now, another important thing to mention about the trend line is the p-value, which is 0.05. The general alpha, or the significance level of most of statistical graphs, is 0.05. And we can see here that our p-value is slightly higher than the alpha value, because this is 0.053. Since the p-value is small, it is considered significant, meaning that the data could follow the trend line by the next year. But it's also important to note that since the p-value is very close to the alpha, it means that we need to gather more evidence to say that we are confident about the trend line. I want to also mention the minimum and maximum. The minimum is 16 for July 2023, while on the other hand, the maximum is by the end of the year, which is somewhat alarming because this is reaching by the next year. And this could be happening because December is near Christmas and New Year, and theoretically, people might be going out to places and getting themselves exposed. It's one way to make a hypothesis. I'm not saying that this is factually true or backed up by evidence, but this could be one of the factors on why we got a high amount of COVID cases December. As a conclusion for our trendline analysis, the cases could go up, but we cannot say that we are confident that it will go up. It only implies that it could go up, but we need more evidence to confidently say that this is the pattern that the graph will follow by the next year. For the CPE Enterobacter unspecified, we only have one case, which is from April. Another one for February for the CPE unspecified KPC. Now we have Entero/rhinovirus, which has a minimum of 1 and a maximum of 4. Now I'm not sure if this specifies that the outbreak had both of these viruses. And when I read the data description, it did not specify anything about this Entero/rhinovirus. So I cannot say it myself, but rather I would prefer to ask a question in the Toronto Public Health, which I'm showing now, to clarify the data, because I'm not really sure what the slash means. Now I want to cover rhinovirus, which is the second causative agent that had the most outbreaks in Toronto. So we can see here that the minimum is 1 in January and the maximum is 21 in August. Because this is also significant, I want to cover the trend line. Now the trend line has 0.1, which is very high and far from our alpha value, making it not significant and not reliable when it comes to probability. And we can say that the R-square is moderately average because it's 0.30 when rounded up. So that implies that the trend requires more evidences so that we could build more confidence when it comes to thinking about the probability of the amount of rhinovirus that could occur in outbreaks for the year 2024. So that concludes question number 2. Now we will move forward to question number 3, which covers the Toronto healthcare facility with the most outbreaks. So looking at the chart, we have this large amount, which covers the long-term care hospitals, having 601 cases of outbreaks. The second highest being the retirement home, which has 195, which is 18% of the total number of outbreaks overall. Now this is my dashboard, and this shows everything that we covered throughout this presentation. And this is the legend for question number 1, right here. And this one is for question number 2, right here. This workbook will be available in the Tableau website, in which I will send a link in the description. And all of these are interactable. Like for example, if you want to press COVID-19, it will show COVID-19 right here. And if you press something like for enterovirus, it will be highlighted here. For no virus, here. And that concludes my data presentation. Thank you for listening, and thank you for your curiosity. This is the reference that I use for my data presentation, and these are also the softwares that I use to make this project possible. Again, thank you for listening. Bye.